Have you ever experienced a headache so intense that it left you wondering if something more serious might be going on? Do you find yourself reaching for painkillers more often than you'd like? In today's video, we're diving into the crucial warning signs that indicate it's time to consult a doctor about your headaches. This isn't just about temporary relief, it's about understanding when a headache might be a signal of a deeper health issue. By the end of this video, you'll have a clear understanding of the red flags to watch for, empowering you to take control of your health. We'll cover everything from sudden, severe headaches to patterns that shouldn't be ignored. Imagine the peace of mind that comes from knowing whether your headaches are something to monitor or a reason to seek medical advice immediately. Stay tuned if you've ever felt confused or worried about your headaches. We'll answer essential questions that could potentially save you from serious health complications. Ready to take charge of your well-being? Let's get started. Alright, let's kick things off with the basics. A headache is that annoying pain or discomfort in your head or face that everyone seems to get at some point. But not all headaches are created equal. There are actually a few different types. The most common one is the tension headache, which feels like a tight band squeezing around your head. Then, there are migraines, which are like the boss level of headaches. Throbbing pain, usually on one side of the head, often accompanied by nausea, and sensitivity to light and sound. Lastly, we have cluster headaches, which are intense, burning pains usually around one eye, and they come in groups, hence the name. You might be surprised to learn just how many people suffer from headaches. According to the World Health Organization, it's estimated that almost half of the adult population has had at least one headache within the last year. That's a lot of people reaching for the painkillers. And it's not just the occasional headache we're talking about. Around 1 in 7 people worldwide deal with migraines, making it a significant global health issue. So, if you've been feeling like you're the only one battling with headaches, trust me, you're not alone. Understanding the type of headache you're dealing with is the first step in managing it effectively. Each type has its own triggers and treatments, and knowing what you're up against can make a huge difference. So, next time you feel that familiar pain creeping in, you'll have a better idea of what's going on and what you can do about it. Stick around, because we'll dive into those warning signs that tell you when it's time to stop toughing it out and see a doctor. So, let's get into what might be causing those pesky headaches. One of the biggest culprits? Stress. Yep, that never-ending to-do list and constant worry can manifest as a pounding head. When you're stressed, your muscles tense up, especially around your neck and shoulders, and that tension can lead straight to a headache. Another common trigger is dehydration. Our bodies are around 60% water, so when you're not drinking enough, your brain can temporarily shrink from fluid loss, causing it to pull away from the skull and, ouch, you've got a headache. And let's not forget about lack of sleep. If you're not getting those solid 7-9 hours of shut-eye, you're setting yourself up for a world of hurt. Your body needs rest to recover, and without it, headaches can easily creep in. Now, beyond these immediate triggers, there are some lifestyle factors that can play a big role in how often you're hit with headaches. First up, diet. Skipping meals or eating a lot of processed foods can cause blood sugar levels to drop or spike, leading to headaches. Caffeine is another tricky one. While that morning coffee can help get you going, too much caffeine, or suddenly cutting back, can both trigger headaches. Then there's alcohol, particularly red wine, which can be a trigger for many people. Another lifestyle factor is posture. If you're hunched over a computer all day or craning your neck to look at your phone, you're putting strain on your neck and shoulders, which can lead to headaches. And let's talk about exercise. While a good workout can actually help prevent headaches by reducing stress, overdoing it or not warming up properly can have the opposite effect. Finally, weather changes can also be a factor. Some people are really sensitive to changes in barometric pressure, and those shifts can bring on a headache. Understanding these triggers and lifestyle factors is key to managing and preventing headaches. By making some small adjustments, like drinking more water, getting enough sleep, eating regular meals, and being mindful of your posture, you can potentially reduce the frequency and severity of your headaches. So, if you're noticing a pattern in when your headaches strike, take a step back and consider what might be setting them off. This knowledge is power and can make a huge difference in your daily life. Alright, now let's get serious. While most headaches are just annoying, there are certain warning signs that you should never ignore. First up, if you experience a headache that comes on suddenly and severely, like a thunderclap out of nowhere, it's time to see a doctor. These types of headaches can be a sign of something serious like a brain aneurysm or a stroke, and they need immediate medical attention. Another red flag is if your headaches are becoming more frequent or intense. If you're noticing that you're popping painkillers more often, or the pain is getting worse with each episode, it's a good idea to consult a healthcare professional. Consistent headaches that disrupt your daily life can be a sign of an underlying condition that needs to be addressed. Now, let's talk about neurological symptoms. If your headache is accompanied by confusion, vision problems, weakness, or numbness, it's crucial to seek medical help. These symptoms could indicate a range of issues, from migraines with aura to more serious conditions like a stroke or brain tumor. Similarly, headaches paired with a fever, neck stiffness, or nausea and vomiting could be signs of meningitis or other infections that require prompt treatment. Headaches following a head injury are another major concern. Even if the injury seemed minor at the time, if you're experiencing headaches afterward, it could be a sign of a concussion or other complications. It's always better to be safe and get checked out by a professional. Age is another factor to consider. If you start getting new headaches after the age of 50, it's important to consult a doctor. This could be a sign of temporal arteritis or other conditions that are more common in older adults. Lastly, pay attention to any significant changes in your headache patterns. If you notice anything unusual or different about your headaches, it's worth getting it checked out. In short, don't brush off these warning signs. Your health is too important. If any of these symptoms sound familiar, make an appointment with your doctor. Catching potential issues early can make a huge difference in your treatment and overall well-being. Alright, now let's dive into when you need to drop everything and get medical help immediately. Picture this. You're going about your day, and suddenly you get hit with the worst headache of your life. This isn't just a bad headache. It feels like a lightning bolt struck your head. This kind of sudden, severe pain is a major red flag. It could be a sign of a brain aneurysm or a stroke. If this happens, don't wait around. Call emergency services or get to the nearest hospital right away. Time is critical in these situations. Another scenario to watch out for is if you have a headache accompanied by stroke symptoms. These include sudden numbness or weakness, especially on one side of the body, confusion, trouble speaking or understanding speech, vision problems, difficulty walking, dizziness, or loss of balance. A headache with any of these symptoms can indicate a stroke, and immediate medical attention is crucial. The faster you get treated, the better your chances of recovery. Let me share a couple of real-life examples to drive the point home. I once knew someone who ignored a severe headache that came on suddenly. They thought it was just a migraine and tried to sleep it off. By the time they sought help, they had suffered a stroke, and their recovery was much harder than it could have been. On the flip side, there's a story about a woman who experienced a sudden, intense headache at work. She recognized the symptoms of a possible aneurysm, called 911, and got to the hospital in time for life-saving surgery. Her quick action made all the difference. Then there are situations where a headache follows a head injury. Even if the injury seemed minor at first, a headache afterward can indicate a concussion or more serious brain injury. If you or someone else experiences this, it is crucial to get checked out immediately. Delaying can lead to complications that are much harder to treat later on. In summary, don't gamble with your health when it comes to severe headaches and accompanying symptoms. If you ever find yourself in one of these emergency situations, seek help immediately. It's better to be safe and get checked out than to risk serious health consequences by waiting. Your health and well-being are worth it. Alright, so you've decided to see a doctor about your headaches. What happens next? First up is the medical evaluation. Your doctor will start by asking you a bunch of questions about your headache history. They'll want to know when your headaches started, how often you get them, what they feel like, and if you've noticed any patterns or triggers. They might ask about your family history too, since headaches can run in families. It might feel like a lot of questions, but this info helps paint a picture of what's going on. Next, expect a physical exam. Your doctor will check your vitals, blood pressure, pulse, and all that good stuff. They'll also do a neurological exam to see how your nerves are working. This might include testing your reflexes, muscle strength, and sensory responses. They might ask you to follow a light with your eyes or touch your finger to your nose. It sounds basic, but these tests can reveal a lot about what might be causing your headaches. Now, if your history and physical exam suggest that something more serious could be at play, your doctor might order some tests. Common ones include MRI and CT scans. An MRI, or magnetic resonance imaging, uses powerful magnets and radio waves to create detailed images of your brain. It's great for spotting things like tumors, infections, or any structural issues that might be causing your headaches. On the other hand, a CORT scan, which stands for computed tomography, uses X-rays to create cross-sectional images of your brain. It's often used to quickly detect bleeding in the brain, especially after an injury. Sometimes, they might also do a blood test to check for underlying conditions like infections or hormonal imbalances that could be contributing to your headaches. In certain cases, a lumbar puncture, also known as a spinal tap, might be done to check for infections or bleeding in the brain and spinal cord. It sounds scary, but it can provide crucial information. Understanding the diagnostic process can take a lot of the fear out of seeing a doctor for your headaches. Knowing what to expect and why these tests are done can help you feel more prepared and less anxious. The goal is to get to the bottom of what's causing your headaches so you can find the right treatment and start feeling better. So, if you're experiencing warning signs or just want to get a handle on your headaches, don't hesitate to make that appointment. Your health is worth it. So, you've gone through the diagnostic process, and now it's time to talk treatment options. First up, medications. There are several types of meds that doctors might prescribe depending on the type of headache you have. For tension headaches, over-the-counter pain relievers like ibuprofen or acetaminophen can do the trick. For migraines, things get a bit more specific. Triptans are a common prescription for migraines. They help by narrowing blood vessels and blocking pain pathways in the brain. For really stubborn headaches, your doctor might suggest preventive medications that you take daily to reduce the frequency and severity of headaches. These can include beta blockers, certain antidepressants, or even anti-seizure drugs. But medication isn't the whole story. Lifestyle changes play a huge role in managing headaches. Let's talk about some simple but effective changes you can make. First, hydration is key. Make sure you're drinking enough water throughout the day because dehydration is a major headache trigger. Also, keeping a regular sleep schedule can help prevent headaches. Aim for 7-9 hours of quality sleep each night. Diet is another big factor. Eating regular meals and avoiding trigger foods like processed snacks, alcohol, and too much caffeine can make a big difference. Stress management is crucial too. Techniques like yoga, meditation, or even just taking time out for a hobby you enjoy can help reduce stress and keep those headaches at bay. Finally, there are various therapies that can complement medications and lifestyle changes. Physical therapy can be really beneficial, especially if your headaches are related to tension or posture issues. A physical therapist can teach you exercises and stretches to improve your posture and relieve tension in your neck and shoulders. Counseling or cognitive behavioral therapy, CBT, can help if your headaches are related to stress or anxiety. Learning how to manage your stress more effectively can reduce the frequency and severity of your headaches. And don't forget about alternative treatments. Some people find relief through acupuncture, which involves inserting thin needles into specific points on the body to balance energy flow. Others swear by chiropractic adjustments or biofeedback, which teaches you to control bodily functions like heart rate and muscle tension. Essential oils, like peppermint or lavender, can also be helpful when applied to the temples or used in aromatherapy. The key is to find what works best for you and to be open to trying different approaches. In summary, treating headaches often requires a multifaceted approach. Combining medications, lifestyle changes, and various therapies can provide the best relief and help you manage your headaches more effectively. So, don't just rely on popping a pill. Take a holistic approach to your health and well-being. Your head will thank you for it. Let's talk about how to keep those headaches at bay before they even start. Prevention is key, and it all begins with your daily habits. First up, hydration. Drinking enough water throughout the day is crucial. Dehydration is a common headache trigger, so make sure you're sipping on water regularly. Aim for at least 8 glasses a day, more if you're active or it's hot outside. Next, let's tackle sleep. Consistent, quality sleep can make a huge difference. Try to go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock and can reduce the likelihood of waking up with a headache. Stress management is another biggie. Chronic stress can lead to frequent headaches, so finding ways to relax is essential. Incorporate stress-busting activities into your routine, like yoga, meditation, or even just taking a few minutes each day to breathe deeply and unwind. Exercise is also fantastic for stress relief and overall health. Aim for at least 30 minutes of moderate exercise most days of the week. It doesn't have to be anything intense. A brisk walk, a bike ride, or a gentle jog can do wonders. Now, let's talk about tracking your triggers. Keeping a headache diary can be a game changer. Note down when you get headaches, what you were doing, what you ate, how you slept, and any stressors. Over time, you might notice patterns or specific triggers that you can avoid. Maybe certain foods set you off, or perhaps your headaches are more frequent when you skip meals or don't get enough sleep. By identifying these triggers, you can take steps to avoid them and reduce the frequency of your headaches. It's also important to pay attention to your posture, especially if you're sitting at a desk all day. Poor posture can lead to tension headaches, so make sure your workstation is ergonomically set up. Keep your computer screen at eye level, sit up straight, and take breaks to stretch every hour. Little adjustments can make a big difference. Finally, don't underestimate the power of routine. Consistency in your daily habits can help your body find a natural rhythm and reduce the chances of headaches. Eat balanced meals at regular times, get plenty of fresh air, and make time for activities that you enjoy and that relax you. In short, preventing headaches is all about taking care of yourself and paying attention to your body. By making small, consistent changes to your daily habits and keeping track of your triggers, you can create a headache-free lifestyle that keeps you feeling your best. We've covered a lot of ground today about headaches, what they are, common causes, when to see a doctor, the diagnostic process, treatment options, and preventive measures. Remember, headaches are more than just a pain. They can be a signal that something else is going on in your body. If you notice sudden severe headaches, increasing frequency, neurological symptoms, or headaches after a head injury, it's crucial to seek medical advice. Now, here's your call to action. If you're experiencing any of these warning signs, don't hesitate to reach out to a healthcare professional. Your health is too important to ignore, and catching potential issues early can make a huge difference in your well-being. So, take that step towards better health today. Don't forget to like this video, drop a comment below if you have any questions or tips to share, and subscribe to our channel for more health-related content. We're here to help you live your best life, headache-free. As we close out, I want to leave you with a final thought. Taking care of your health is a journey, not a destination. Every small step you take towards better habits can make a big difference over time. So, keep making those positive changes and listen to your body. It's always trying to tell you something. Thank you so much for watching. Your support means the world to us. If you found this video useful, please share it with friends and family who might benefit from this information. And don't forget to check out our previous video, Vicks VapoRub. 11 uses from cold relief to beauty routine, for more great tips and tricks. Stay healthy, stay happy, and we'll see you in the next video.